If you or someone you love is facing breast cancer, know this first: you have options. You have hope. Today, we'll gently explain KeyCap 1 all standard treatments, and how they work. KeyCap 2 new 2024 therapies, including less toxic options. KeyCap 3 how to choose what's right for your unique case. This isn't just medical information, it's a roadmap to empowerment. How to treat breast cancer, your guide to understanding treatment options. When it comes to how to treat breast cancer, there's no one-size-fits-all approach. Your treatment will depend on several personal factors, including the type and stage of your cancer, your overall health, and your preferences. Some people have multiple options, while others receive a clear recommendation from their medical team. Main treatment options for breast cancer. Doctors often use a combination of treatments to fight breast cancer effectively. These are the most common options: surgery, to remove the tumor or breast tissue. Chemotherapy, drugs that kill cancer cells throughout the body. Radiotherapy, high-energy rays to destroy cancer in a specific area. Hormonal therapy, endocrine therapy, blocks hormones that fuel some cancers. Targeted therapy and immunotherapy, drugs that target specific cancer cell features or boost your immune system. Bone-strengthening drugs, bisphosphonates, help protect your bones, especially if cancer affects them. Your treatment plan will be tailored to you, which is why it may look different from someone else's. This guide focuses on treatments for early breast cancer, when the cancer hasn't spread to other distant parts of the body. If your cancer has spread to areas like the lungs, liver, or bones, this is called secondary or advanced breast cancer, and treatment options can be different. Deciding on the right breast cancer treatment. Choosing how to treat breast cancer involves a team of specialists working together. This group is known as a multidisciplinary team, MDT. They meet to review your test results and create a treatment plan just for you. Your MDT may include a breast surgeon, a medical oncologist, cancer doctor, a breast cancer nurse or clinical nurse specialist, CNS, a radiologist, expert in reading scans, a pathologist, examines cancer cells under a microscope, a plastic surgeon, specialist in breast reconstruction, a breast cancer research nurse. They will explain the treatment, its benefits, and any side effects, so you can make informed decisions. What factors affect your treatment plan? Several things determine how to treat breast cancer in your specific case: location of the cancer in your breast, size and stage of the cancer, has it spread? Type of breast cancer, grade, how abnormal the cancer cells look under a microscope, hormone receptor status, whether cancer cells have certain proteins, whether you've been through menopause, your general health and fitness, your personal preferences. Making the best choice for you. Sometimes your doctor will give you a choice between treatments. It's important to talk through each option, including how effective the treatment is likely to be, what side effects you may experience, how it could impact your daily life, whether extra appointments or tests are needed. As your situation changes, your options might change too. Keep asking questions and gather as much information as you can. This will help you feel more confident in your decisions. Surgery for breast cancer, what to expect and your options. For many people, surgery for breast cancer is the first step in treatment. In some cases, you may be offered chemotherapy or hormonal therapy before surgery to shrink the tumor and make it easier to remove. There are several types of breast cancer surgery, and your doctor will recommend the best one based on the size, location, and stage of your cancer, as well as your personal preferences. 1. Breast-conserving surgery, lumpectomy. If the cancer is small and localized, you may be able to have a lumpectomy, also known as breast-conserving surgery or wide local excision. This procedure removes the tumor along with a small margin of healthy tissue, preserving most of your breast. This is a common option when early-stage cancer is found in just one area of the breast. 2. Mastectomy, surgery to remove the whole breast. In some situations, your surgeon may recommend removing the entire breast. This procedure is called a mastectomy. It's often suggested if the cancer is large or in multiple areas of the breast. there's a high risk of recurrence. You may choose to have a breast reconstruction, which reshapes the breast using implants or your own tissue. This can be done at the same time as the mastectomy or later on, depending on your preference and overall treatment plan. 3. Lymph node surgery, axillary surgery. Breast cancer can spread through the lymphatic system, especially to the lymph nodes in the armpit, axilla. To check whether the cancer has spread, your doctor will usually perform an ultrasound scan of your armpit. Take a biopsy if any lymph nodes look suspicious. If the lymph nodes appear normal, you will likely have a sentinel lymph node biopsy during your breast surgery. This involves removing the first few lymph nodes that drain fluid from the breast to check for cancer cells. If cancer is found in the lymph nodes, your surgeon may perform axillary lymph node clearance, removing most or all lymph nodes in the armpit. Targeted axillary dissection, removing only the affected nodes. These procedures are usually done during your main breast surgery or as a follow-up operation. Making the right decision. Your medical team will guide you through the best surgical option based on your unique case. They'll help you weigh the benefits and risks of each type of surgery for breast cancer, including recovery time, appearance, and the possibility of needing further treatments. Remember, every person's journey is different, and the right choice is the one that fits your situation, body, and life. Radiotherapy, chemotherapy, and hormone therapy, how to treat breast cancer effectively. When exploring how to treat breast cancer, many people receive more than just surgery. Depending on your diagnosis, your care team might recommend radiotherapy, chemotherapy, or hormone therapy as part of your personalized treatment plan. Let's break down what each treatment involves and when it might be used. Radiotherapy for breast cancer. Radiotherapy uses high-energy X-rays to target and destroy cancer cells. It's most commonly given after breast-conserving surgery, lumpectomy, to reduce the chance of the cancer coming back in the same area. Most people have between 5 and 15 sessions, also called fractions. Some people may need radiotherapy after a mastectomy, especially if the tumor was larger than 5 centimeters, cancer had spread to nearby lymph nodes. In some cases, radiotherapy is also directed at the lymph nodes in the armpit, axilla, to treat or prevent further spread. Chemotherapy for breast cancer. Chemotherapy involves using anti-cancer drugs that travel through the bloodstream to destroy cancer cells throughout the body. It may be given before surgery, called neoadjuvant chemotherapy helps shrink the tumor, possibly allowing for a lumpectomy instead of a mastectomy. Reduces the risk of the cancer returning later. After surgery, called adjuvant chemotherapy helps kill any remaining cancer cells and lowers the risk of recurrence. Your doctor will decide on the timing based on the size and spread of your cancer, your overall health, and other test results. Hormone therapy for breast cancer. Hormone therapy is used for certain breast cancers that need estrogen to grow. These cancers are called estrogen receptor positive, ER+, breast cancers. Hormone therapy works by blocking estrogen receptors or lowering estrogen levels in the body. You may receive hormone therapy after surgery, the most common use, usually taken for 5 years or longer. Before surgery, neoadjuvant hormone therapy to shrink the tumor and make surgery easier. The type and duration of hormone therapy depends on the specific drug, how your body responds, and any side effects. What's next in your breast cancer treatment? Each of these treatments, radiotherapy, chemotherapy, and hormone therapy, plays a different role in how to treat breast cancer. Your doctor will help you understand which ones are right for you, based on your cancer type, stage, and personal needs. Stay informed, ask questions, and take your time to make decisions that feel right for you. Targeted therapy, immunotherapy, and other treatment options, how to treat breast cancer with precision. When looking at how to treat breast cancer, new and advanced treatments like targeted cancer drugs, immunotherapy, and bone-strengthening medicines may be recommended depending on your specific diagnosis. These options help treat certain types of breast cancer more precisely and improve long-term outcomes. Targeted cancer drugs for breast cancer. Targeted therapies are designed to attack specific features that make cancer cells different from normal cells. They help stop cancer cells from growing, dividing, or surviving. One common target is a protein called HER2, human epidermal growth factor receptor 2. If your cancer is HER2 positive, your doctor may recommend targeted drugs like trastuzumab or similar HER2 targeting treatments. Another group of targeted drugs are called CDK4/6 inhibitors, which block proteins that cancer cells use to multiply. An example is abemaciclib, often used if you have hormone receptor positive and HER2 negative breast cancer. These treatments are not suitable for everyone. Your doctor will test your cancer cells to see which treatments are most likely to work. Immunotherapy for breast cancer. Immunotherapy helps your immune system recognize and attack cancer cells. One drug used in breast cancer treatment is pembrolizumab. You may be offered pembrolizumab if you have triple-negative breast cancer. This type of cancer lacks receptors for estrogen, progesterone, and HER2, making it harder to treat with hormone or HER2-targeted drugs. Immunotherapy is often combined with other treatments such as chemotherapy, especially for more aggressive breast cancers. Bone-strengthening drugs, bisphosphonates. Bisphosphonates are medicines that protect your bones and help prevent them from thinning or breaking. You might be given drugs like zoledronic acid or sodium clotronate if you've been through menopause. You're at risk of breast cancer spreading to the bones. You're already experiencing bone loss, osteoporosis. These treatments may be part of your plan even if your cancer is under control, to support your long-term bone health. Using tools to choose the right treatment. Choosing the best way to treat breast cancer can feel overwhelming. Thankfully, your doctor and specialist nurse will guide you through each option and explain the pros and cons. There's also a computer tool called Predict, designed to help patients and doctors understand how different treatments might impact recovery and long-term outcomes. It uses your cancer details and treatment options to estimate the benefits of each therapy. It can be helpful if you're unsure whether to add chemotherapy, hormone therapy, or other treatments to your plan. Ask your doctor if you'd like to use the Predict tool or need help understanding the results. Genetic tests and second opinions, making confident decisions on how to treat breast cancer. When exploring how to treat breast cancer, one important part of the journey is understanding whether your cancer is likely to come back, and whether additional treatments like chemotherapy can help reduce that risk. Your doctor might recommend tumor profiling tests, also called gene expression profiling, GEP, tests, to help guide these decisions. What are tumor profiling, GEP, tests? Tumor profiling tests look at the genes in your breast cancer cells to predict how likely the cancer is to return after treatment. These tests can also help determine whether chemotherapy will be beneficial in your specific case. Some commonly used gene tests include EndoPredict, EPCLIN score, Oncotype DX breast recurrence score, Prosigna. These tests are usually done on a sample taken during surgery, so you won't need any extra procedures. Your doctor will let you know if gene testing is suitable for you and how the results may affect your treatment plan. Considering a second opinion. Breast cancer treatment can involve many different options, and it's normal to feel unsure. If you're uncertain about the recommended treatment, you can ask for a second opinion from another specialist. Here's what to keep in mind: the second doctor will need to review your test results and diagnosis. This does not mean switching doctors. They usually collaborate with your original team to confirm or adjust your treatment plan. Getting a second opinion might take some time and could slightly delay treatment, so weigh the pros and cons. Before your appointment, write down your questions to help you feel confident and clear when discussing your concerns. Talking things through again with your current doctor might also help clear up confusion and give you peace of mind. Empowering yourself in breast cancer treatment. Knowing how to treat breast cancer isn't just about the treatments themselves, it's also about understanding your options and making decisions that feel right for you. Tools like gene testing and the option for a second opinion can provide clarity and reassurance as you move forward. Wherever you are in your journey, just diagnosed, mid-treatment, or years in remission, your strength inspires us. Join our support circle. Keycap 1 like to spread awareness. Keycap 2 subscribe for more life-saving guides. Keycap 3 comment with words of hope. At HeInfo, we believe knowledge plus compassion equals power. Keep fighting, beautiful warrior.